This is Martin Giles of the Guildford Dragon News, and I'm with Dr. Bill Dewsbury, who's the Medical Director at the Royal Surrey County Hospital Trust. Thank you for joining the Guildford Dragon, Dr. Dewsbury.
You're welcome, Martin, and Happy New Year.
And Happy New Year to you. But unfortunately, not that happy when it comes to the issue we're covering, which is the junior doctors strike, which is currently underway. It started this morning. How is the current strike action affecting medical services at the Royal Surrey and throughout the Trust?
So at the moment, we are managing to maintain our services, particularly our urgent emergency care and our cancer services. Clearly, we've put a lot of planning into making sure that we've got a resilient plan for this period of industrial action. We were planning for this pre-Christmas. And our plans seem so far to be holding. Unfortunately, though, we don't have the level of medical cover that we normally have. We've had to redeploy senior doctors from their normal working practice into areas to cover where junior doctors are not working. And so we have had to cancel some of our elective procedures in theatres and also some of our elective outpatient activity as well.
Okay, so can you give us some kind of idea of the scale of that effect? Now, how many appointments, for instance, have had to be postponed?
So we don't know exactly yet for this period of industrial action, but I can give you an example from the last period of industrial action, which was 3 working days. This will be 4. And we cancelled around 60 procedures in theatres and around 550 outpatient appointments.
Okay, is it affecting A&E as well?
Pardon? Could you repeat?
Is it affecting accident and emergency?
It affects accident and emergency in that we don't have the same level of cover that we normally would have, but we have planned to bring in some of our other doctors into the accident and emergency and into the emergency teams so that we can cover the gaps that have been left by the junior doctors. So we are still able to provide the service that our patients need in the accident and emergency department for those urgent and emergency cases that come through.
Okay, and has the wait time for that service been affected?
We haven't seen the wait time be affected directly by industrial action. This week, as I'm sure you are aware, is a week that is traditionally pressured within the NHS, the week after New Year. And we are still seeing those traditional seasonal pressures. So we have seen our wait times increase in the emergency department, yes.
Thank you. And the seasonal pressures, I think we all know about COVID still around, of course, and flu that's more prevalent at this time of year. Are there any other seasonal pressures?
So we tend to find that because patients have been enjoying the festive period, have been away maybe during the festive period, that we see some patients presenting later than they normally would, who've maybe been at home with their complaint for slightly longer than normal. So we tend to see a slight delay, a lag, if you like, in patients presenting. We also know that we struggle more at this time of year to discharge patients. It's harder to make discharge plans, particularly for patients that require ongoing care over the Christmas period. So that slows us down a little bit. And then we have, some patients have seen their relatives over the Christmas, New Year period, and their relatives have noticed that perhaps they're not quite as well as they previously were and have encouraged them to access medical care. So there's a number of different factors, along with the fact, as you say, that we have winter viruses present, which includes COVID now. And clearly people have been enjoying Christmas and New Year, meeting their family and friends. And so there's been more mixing, and that tends to lead to a higher level of those winter viruses in this week as well.
Okay, thank you. So you've obviously been able to prepare for this, and you've mentioned that you've some senior doctors are covering for junior doctors, and that you've postponed some of the appointments. Are there any other preparations you were able to make?
Not really. We've got clearly a limited workforce, so we have to work with what we have. I think the key for us has been to try and ensure that we maintain both the emergency service, so people are still able to access emergency care. So if patients are at home and they feel that they've got a medical emergency, they must still access that. We are still here for them. They can still call an ambulance, arrive at ED. We will still provide that care. We've also prioritized our cancer care, because as a cancer center, those patients are often on treatment regimes, and we work very hard to minimize the impact on them. And then also patients who need urgent other procedures, most commonly within surgery. So that's where we concentrate our planning to ensure that we can continue to maintain those services, and then that we can continue to maintain the cover for those patients who are already in hospital who need looking after on the ward, so that we keep their treatment pathways moving forward. And that also helps us to ensure that we can then get those patients fit enough to leave hospital, and then their bed becomes available for the next patient who's waiting in ED, and we keep the flow moving.
Okay. Do you have any sympathy for the junior doctors?
So we work really closely with our junior doctors, and they're a really valued part of our workforce. So, we understand the depth of feeling that they have, and we recognise that they have the right to take industrial action. Clearly, it is disruptive and it impacts on our other staff. So we would be, very keen that nationally, between the BMA and the government, that this dispute is resolved, and we would encourage everybody to get back around the table and talk it out. But yeah.
Okay. I have seen some reports in the media elsewhere of tension between the consultants and the junior doctors, because is that manifested itself at the Royal Surrey?
Not yet, and I would hope that it doesn't. We've worked very hard to ensure that what is a national dispute doesn't become a local industrial relations problem. So that isn't just between senior doctors and junior doctors, that's between all staff within the organisation, because it isn't just senior doctors who are covering for junior doctors. Nurses and other allied health professionals are also stepping into the gap. So we're working extremely hard to make sure that that doesn't occur.
Okay, and finally, and important, I think you have mentioned some of the things that the way the public can help, and we have published the advice on your website in our story covering this. But if there's one message you want to get out to the public at the moment, what would it be?
So to use access to healthcare in a sensible and considered way. So if you feel that you have a medical emergency, you really must access healthcare. We are still here for you. If you're unsure that at the level of your medical need, then there are other options available to you, and we would ask you to use them sensibly. So that includes pharmacists for advice and potentially medication. It includes minor injuries units, and our minor injuries unit at Hazelmere is open from 8 to 5, 7 days a week for all patients over the age of 2 with injuries. And then there is NHS 111 available for advice as well, which can either be accessed online or by telephone. So we're really asking that people use healthcare services carefully and sensibly, but that if you need to access healthcare, that you continue to do so.
Dr. Bill Dewsbury, the Medical Director at the Royal Surrey County Hospital, thank you very much.
You're very welcome. Thank you.